In this video by DeckPlate we will understand the VA disability ratings for maxilla or mandible, chronic osteomyelitis, osteonecrosis or osteoradionecrosis of, mandible, loss of, complete, between angles, mandible, loss of. Including ramus, unilaterally or bilaterally, mandible, nonunion of, confirmed by diagnostic imaging studies, mandible, malunion of, Condyloid process, loss of, one or both sides, Coronoid process, loss of, hard palate, loss of teeth, loss of, due to loss of substance of body of maxilla, or mandible without loss of continuity. Disclaimer, this video is for educational purpose only. It's not intended for doctor-patient or lawyer-client relationship. Oral and dental conditions. Conditions can significantly impact veterans' quality of life, from chewing difficulties to facial structure changes. In this video we will discuss different conditions, their diagnostic codes, and the associated VA disability ratings. Maxilla or mandible, chronic osteomyelitis, osteonecrosis, or osteoradionecrosis. Diagnostic code, 9900. Chronic osteomyelitis, or osteonecrosis, often results from long-term inflammation, and osteoradionecrosis occurs due to radiation therapy, typically for cancer treatment. Evaluated under Diagnostic Code 5000 for osteomyelitis. Mandible, loss of, complete, between angles. Diagnostic Code 9901. This condition refers to the complete loss of the lower jaw between the angles, severely affecting facial structure and function. Rating, 100%. Mandible, loss of including ramus, unilaterally or bilaterally. Diagnostic Code 9902. Loss of one half or more involving the temporomandibular articulation. Not replaceable by prosthesis, 70%. Replaceable by prosthesis, 50%. Loss. Not involving temporomandibular articulation, not replaceable by prosthesis, 40%. Replaceable by prosthesis, 30%. Loss of less than one half involving temporomandibular articulation, not replaceable by prosthesis, 70%. Replaceable by prosthesis, 50%. Loss. Not involving temporomandibular articulation, not replaceable by prosthesis, 20%. Replaceable by prosthesis, 10%. Mandible, non-union of Diagnostic Code 9903. This refers to a fracture of the mandible that does not heal properly, resulting in a false joint. Severe, with false motion, 30%. Moderate, without false motion, 10%. Mandible, malunion of Diagnostic Code 9904. Malunion refers to the mandible healing in an incorrect position after a fracture. Severe anterior or posterior open bite, 20%. Moderate anterior or posterior open bite, 10%. No open bite, 0%. Temporomandibular disorder TMD, Diagnostic Code 9905. TMD affects the jaw joint, causing pain and limited range of motion. Ratings depend on the range of jaw opening and any dietary restrictions. 0 to 10 millimeters of vertical opening, with dietary restrictions to all mechanically altered foods, 50%. Without dietary restrictions, 40%. 11 to 20 millimeters of vertical opening, with dietary restrictions, 40%. Without dietary restrictions, 30%. 21 to 29 millimeters of vertical opening, with dietary restrictions, 30 to 40%. Without dietary restrictions, 20%. 30 to 34 millimeters of vertical opening, with dietary restrictions, 20 to 30%. Without dietary restrictions, 10%. Lateral jaw motion is also considered, with a 10% rating for movement limited to 0 to 4 millimeters. For VA compensation purposes, the normal maximum unassisted range of vertical jaw opening is from 35 to 50 millimeters. Condyloid process, loss of, Diagnostic Code 9908. The condyloid process is part of the mandible that forms the jaw joint. Loss of this structure can severely impact jaw movement. Loss of one or both sides, 30%. Coronoid process, loss of, Diagnostic Code 9909. The coronoid process is the front part of the mandible that serves as an attachment for muscles used in chewing. Bilateral loss, 20%. Unilateral loss, 10%. Hard palate loss of Diagnostic Code 9911, loss of half or more, not replaceable by prosthesis, 30%. Loss of less than half, not replaceable by prosthesis, 20%. Loss of half or more, replaceable by prosthesis, 10%. Loss of less than half, replaceable by prosthesis, 0%. Teeth, loss of diagnostic code 9913, loss of all teeth, 40%. Loss of all upper or lower teeth, 30%. Loss of all upper and lower posterior teeth, 20%. Loss of all upper and lower anterior teeth, 20%. Loss of all upper anterior teeth, 10%. Loss of all lower anterior teeth, 10%. Loss of all teeth on one side, 10%. Where the loss of masticatory surface can be restored by suitable prosthesis, 0%. These ratings apply only to bone loss through trauma or disease, such as osteomyelitis, and not to the loss of the alveolar process as a result of periodontal disease, since such loss is not considered disabling. Thank you for watching this video. Please don't forget to subscribe and like our videos.